Hello, viewers. Hope all of you are doing truly well, as I normally ask you. Today we are here with a very important topic, and you can see it at the back of me. That is, what is diabetes? Lots is actually spoken about on this topic, but uh, today we are going to make another attempt at it to address this complex topic in a very similar, in a very simple way. And for that we do have a very internationally knowledgeable, experienced, acclaimed faculty, Dr. Alok Modi, with us. And Dr. Alok Modi, it's a pleasure to have you with us today.
Thank you.
Well, I am actually going to take the privilege to introduce him, as he's going to help us understand this simple yet very complex topic in a very simple way. Dr. Alok Modi is, of course, MD, FISH, that is basically a fellow of the Hypertension Society in India, FACT, USA, PGDL from the UK. He's consultant physician, of course, at three different places: Jupiter Hospital, Cable Hospital, Thane, and also Dr. Modi's Diabetes Center. He's been very much active in this field for almost now to close to 3 decades. He's proper from one of the most topmost institutes, or rather the hospital in Mumbai, that is the KM Hospital, very well known. And he's also a fellow of the, like I said, the American College of Physicians, also USA is fellow of the Indian Society of Hypertension. He's ex-faculty, Shivaji Hospital and Rajiv Gandhi Medical College, certified by the by the American Diabetes Association, South Asia Pacific region, as a qualified trainer in diabetes for medical practitioners. He has publications and presentations at national conferences and journals. He extensively talks at many places, not only the associations, but a lot of patient talks, a lot of corporate talks. And you will, of course, know in this session today how well he can actually make us more aware and educate us about this topic. Managing committee member and the medical legal committee member at the Association of Medical Consultants. It's a real pleasure to have you, Dr. Modi, with us today out here. And let me actually get you on the virtual stage here. So a very good evening, and we are really looking forward to understanding this topic with you, really. We all say we seem to know diabetes so well that, you start talking about diabetes today, people say, हाँ sugar है, इसके लिए ये करना चाहिए, वो करना चाहिए, and people, we all have our own thoughts on it. But then I still, though, as a nutrition expert, struggle with understanding the simple meaning of what diabetes really is. And we have that question mark. There are different types of diabetes now. There is also type 1, type 2, but there are different types, newer types that we are coming to know. So we would definitely want to know from you as to what diabetes really means, and how does one really know that he has diabetes. Because there are so many, we know diabetes is only growing, but also the number of people who get diagnosed with diabetes, there's a vast difference between having diabetes and having known you have diabetes. So if you could throw light on it, sir, and we would like to hear from you.
Thank you. First of all, a very warm welcome to the esteemed audience, which has taken a time on a Sunday evening to listen to such an important topic. Tells me that how committed and dedicated you are for your health. That's very encouraging to see an audience assembled here. And before I go ahead, a very warm thanks and for a lovely and a very kind introduction to Dr. Rajashree. She is very humble and very modest. She herself has a big name and a big celebrity who's done extensive work in doing a good amount of research and development of my own experience is so good. Some very fantastic nutraceutical products for the benefit of humanity. She's been conducting wonderful programs and wonderful seminars and processes for the patient population and for the medical fraternity in a very wonderful way. She doesn't need introduction. People who know her know that she's a big name. And it's really kind of you to come down on a Sunday evening to take this wonderful session for the benefit of humanity in general. So a warm welcome to all of you. And like you said, like on a colloquial note, बड़े बड़े जो ताले रहते हैं उनकी चाबियां बहुत छोटी होती हैं, बड़े बड़े प्रॉब्लम्स की सॉल्यूशंस भी बहुत छोटे होते हैं. Diabetes is a big thing. It is an unholy marriage. It is there to trouble you for a lot, and people are scared, and people run here and there. And I've seen so many patients the last 25 years who come out with all kinds of weird therapies, and it just doesn't help. Because what is diabetes? Basically, let's start from there. What is diabetes? Diabetes is nothing but it's a very sweet disease which has very unsweet complications. So diabetes word has come in long back when a farmer realized that ants were coming and licking his urine. And I'm not suggesting it, but if somebody were to taste the urine of a diabetic patient, unlike the expectations, it is very sweet. So you throw a lot of sugar in the urine, and that's how the name diabetes came. So why do you get so much of sugar in the urine? Naturally, you'll get sugar in the urine when the sugar in the blood is very high, because the urine comes from blood. So if the sugar in the blood is very high, you develop something called as diabetes. So what is normal sugar? So normally on an average, the normal levels which are defined as, it should remain between 70 to 110 milligrams per 100 cc of blood. That is the normal blood sugar in a person in a fasting state when he has not eaten. And after you've had your meal, within 2 hours of initiating your meal, not within 2 hours of finishing your meal, but within 2 hours of starting to eat your meal, your sugar should not cross 140 milligrams. So if it crosses 140 milligrams, then means your body is not able to take care of that sugar. And if these parameters are present, then we say you've got diabetes. Now, bottom line is, why do you get diabetes? See, the simple thing is, we all need carbohydrates and blood sugar in our food. We get enough sugar in our food, and that is what is responsible for giving us our energy. Just as you drive a car, you have oil, you have petrol, you have different kind of coolants, you have so many liquids running in a car, but what drives a car is the petrol. So you have proteins, you have fat, you have vitamins, you have so many things when you're eating your food, but what drives the energy for your body is a carbohydrate moiety, which is present in your food, right? So that when it gets burnt, it produces energy, and the simplest, the basic structure of that is something which we call as glucose molecule. जो आप ग्लूकॉन डी लेते हो, तो whatever glucon D you buy in the market for instant energy boost, that is pure glucose. So when that level goes beyond a particular level, it starts damaging your body cells from inside, and it damages over a period of time. So diabetes has a lot of complications down the road. When you have persistently uncontrolled blood sugars, you start damaging your skin, your heart, your kidneys, your eyes, your intestines, your legs. Every part of the body gets damaged. And then we come out with these exotic names in medical parlance like nephropathy, which is kidney damage, retinopathy, which is eye damage, ischemic heart disease or cardiomyopathy, which is heart damage, but not a single part of the body is spared. And then when they decay quite a lot, you get heart attacks, you get paralytic attacks, you get blindness, you get gangrene, so many complications if diabetes is not kept under control. So why do you get diabetes? Why your sugars are not under control? There are two things. Either you're taking a lot of sugar or you're not burning enough sugar, correct? So if you're going to load your car with a lot of gas beyond the tank capacity, you'll what will you do? You'll create an explosion. The car will burst, right? And if you're putting in a lot of diesel, you're not burning it. That extra diesel and all is again a big risk to burn up your car. So you need to exercise and you need to eat proper food. So if there is a mismatch between the kind of quality of food you're eating, so if you're having a carb-rich food, perpetually if you're loading your body with too much of carbohydrates, then the chances of getting diabetes becomes high. And if you're not burning your food well, properly, then chances of getting diabetes becomes high. Then there's a third element is your body. So if your body is destined to pick up a diabetic because of genetic reasons, your parents or your grandparents had diabetes, chances of you getting diabetes again becomes high. So there are all these factors when they combine together, you get diabetes, right? Now I don't want to make it too complicated. Classically, we classify diabetes as type 1 or insulin dependent diabetes, or type 2, which is non-insulin dependent diabetes. Type 1 is also called as IDDM, insulin dependent diabetes. Type 2 is also called NIDDM, non-insulin dependent diabetes. Then you have diabetes, maturity onset diabetes, you have LADA, you have type C diabetes. Those are some rare diabetes. I won't touch those topics today. Type 1 is basically simple. There is no insulin in the body. As you can understand, if you are not a diabetic, I'm not a diabetic, whatever glucose I take in the body, in the food, whatever food I'm eating, there is a lot of carbohydrate that's broken down. It's converted into the basic format called glucose. And that glucose is pushed into different parts of your cell. So जब आप पेट्रोल पंप में जाते हो, आप डीजल या पेट्रोल भरवाते हो, right? So you're not going to take 1 liter petrol, then go from one spot to the other, then again take 1 liter petrol, then go from point B to point C. You load up your 50 to 60 liters in a tank, and then you can drive it comfortably as long as you want. So you eat food once or twice or thrice a day. So you have your breakfast, you'll have your lunch, you have your dinner. You pile up enough energy stocks in your body. So body breaks it down, converts it to glucose, and sends it across all the storage spots, which are the liver, the muscle, and different parts of the body, the kidney, all these areas. Again, that glucose is rebuilt up by the body into a form called as starch. So when you eat food, food is present as starch. So, you've got rice, you've got chapatis, you've got wheat, you've got different kinds of foods which have got loaded with starch. So all this glucose, जैसे आप एक घर देखते हो ना, ईट करके एक दीवार बनती है, तो ग्लूकोज जोड़ करके एक स्टार्च का मॉलिक्यूल बनता है. So that starch is broken down by the body, and then that glucose is again rebuilt into the body. So the starch which is built by the body is called as glycogen, and the starch which is present in your rice and your chapatis and all food and all, that is called as starch. So then again the breakage starts. So that glycogen is broken down as and when you need more energy. So जब आप पढ़ाई करते हो, या फिर जब आप दौड़ते हो, या जब आप मैराथन करते हो, या जब आप movies देखते हो, कुछ ना कुछ your brain is working or your legs are working, or when you're eating you need energy, then the starch is broken down to convert to energy. So if that energy production is reduced, the starch will overflow, you will start getting diabetes. So all these factors, when they work together, you get diabetes. So जब insulin कम रहता है, insulin what it does is it picks up the starch, it picks up the glucose from the intestine and pushes it into the storage spot. So the blood levels come down. So the insulin is less, the blood levels of glucose will remain high, and that is how you get type 1. Now, if insulin is working well, there is enough insulin, but it is not able to work. It is not able to work on the cells like liver and kidney जहाँ पे या muscles जहाँ पे उसको glucose push करना है. Then again, though insulin is working, glucose levels are high, you get type 2 diabetes. That is called non-insulin dependent diabetes mellitus. We call this in medical parlance as insulin resistance. So it's like, ताला और चाबी. You have a tala, you have a chabi. चाबी ठीक से काम नहीं कर रही है, चाबी है नहीं तो ताला खुलेगा नहीं. That is type 1. ताला अच्छा है, चाबी भी है, लेकिन ताला और चाबी का जो कॉम्बिनेशन है वो काम नहीं कर रहा है, तो that is type 2. So what happens is, diabetes is a disease where you have a lot of glucose in the blood, but the body cells are deprived of glucose. So it's like, Mumbai city. There is so much of water around Mumbai city, but आपके घर पे पानी नहीं आ रहा है. So we just like that. That is diabetes. So I hope you have understood. Type 1 is lack of insulin. Type 2, there is a lot of insulin, but it is not functional. Type 1 is always and always hereditary. आप जन्म से लेके पैदा होते हो, type 1 कभी भी बाद में नहीं होती है. Type 2 में resistance आता है. Your pancreas is fine, your insulin is there. There's a lot of resistance because आपने कुछ ऐसा किया है कि आप इंसुलिन को काम नहीं करने दे रहे हो, and that is how you get type 2.
Superb. I think that was simple, very simply broken down the way we wanted it. And you did answer one more of my question, कि, sugar का role क्या होता है इसमें? And, everyone today, that's why, associates diabetes with sugar. But, I'll come to one of these sugar ka more tricky questions in the end of the show. But uske pehle, unless you want to say something on it, but otherwise we want to also understand कि diabetes कितना common है आज, क्योंकि there was a time जब हम बोलते थे कि India is the diabetes capital of the world, but today what is the rate at which it is still increasing? Is it higher? Are the younger population also getting affected more? And who is more likely to get diabetes?
So like I said, that's a very relevant and a very practical question, Dr. Rajashree. Type 1 diabetes occupies around 10% of the ecosystem of diabetes patients. Type 2 is around 90%. So the bulk of diabetes that we are going to treat today is 90. So if I'm going to sit in my clinic, or any diabetologist in the country or in the world is sitting in his clinic, if you're seeing 100 patients in a day, approximately 10 will be type 1, but 90 will be type 2. So we are going to focus on type 2 because that is more relevant. Now I said there are three parts here: how much you eat, and what does your body do, and how much you burn. So body I said is quite normal. Remember I said there is a small genetic component, it's not a big component. What you eat plays a major role, and how much you burn plays a very major role. Now the sad part is the entire humanity from WhatsApp University and Google University and all are crazily focusing on food, food and food. Food is very important, but it is not more important. More important is how much you're exercising. If you're not burning your glucose properly, you're going to develop type 2. The real problem behind developing diabetes is not being able to burn your glucose properly. And that answers your question, why is India becoming a diabetes capital? And why the number of diabetics across the world are increasing? Why more so in countries like India and China? That's because of your lifestyle. So you go back 2 generations back, when your own grandparents were there, the incidence of diabetes was very low in India, because to travel, you needed to hang on to a bus. You needed to stand at a bus station. You needed to go hanging in a bus or in a train. Again, you have to, I remember my days when I was going to KM, I would walk till Thane station, then I would catch a train, remain hanging in the train, then I would walk for 2 kilometers till KM hospital. And then the whole day I would be traveling from one floor to the other in the entire big KM hospital doing my work. So there was no time to sit and stretch out. Today, you have a bike or you have a car in which you travel. You go to the gym, you do 2 hours of pumping up your muscles, but then ironically, you come back in a car, but you don't walk back. You don't go walking to a mall to do shopping. You take your car and go to the mall. You take the elevator and you climb up. And then you don't even do that. You sit and do your entire home, you do your entire office. You do everything on the laptop. You know, the incidence of diabetes had boosted tremendously during COVID because of work from home culture. So it's total lack of exercise. Even for climbing 2 floors, we use an elevator. Even for changing channels, we use a remote control. So how much are you pumping? Now, another concept that people need to know is going to a gym and slogging it out for 2 hours is not the way to cut down diabetes and taking your fulfilling your role of blood sugar management. It's like, I'm married to a very wonderful wife, a very beautiful wife and a very lovely lady. But if I want to keep her happy, I can't just give her one diamond necklace in a year and say, oh, my job is done, the rest of the year I'm not going to look at you. It doesn't work that way. Relations don't go smooth that way. On the contrary, if I can make a cup of tea for her every time she comes from the hospital, I think that was much more than giving a diamond necklace. Of course, for debating a diamond necklace is important, but a cup of coffee plays more important every day. So, if you can exercise every half an hour to 1 hour. So if you go to the offices of Microsoft and Google, they have a wonderful work culture. They force you to work. They force you to get physically active every 2 to 3 hours. They force you to take a break compulsorily, go to the gym and start slogging it out. And they force you to run errands which are not dependent on your vehicles. So, climbing up 2 floors of stairs, not using the remote to change channels, walking to the shopping center, not using your vehicle. Cut down your car and your scooter to the minimum basic requirement. Cut down your elevators to the minimum basic requirement. Cut down online shopping to the minimum basic requirement. Try to use your legs and your hands as much as you can, for as long as you can, in a healthy and a tolerable manner. And don't replace a 24 hours exercise. Not 24 hours. Don't replace a 18 hours exercise if you're going to sleep for 6 hours with just 1 hour of a gym practice. And recently many celebrities have... Sorry, my Windows gets active. So just like it doesn't agree with me. She says, no, you stick to me, you don't go for walking. So, like if you're just going for 1 hour in the gym, you're doing a heavy cardio and pumps up and all that, that doesn't help. And you have seen how many people have died in spite of being physically very healthy. Another big concept, Dr. Rajashree, which I need to tell you, it is the amount of fat in the body which causes resistance. It is not the amount of muscle which causes. The more muscle you have, less is your insulin resistance. And for that, there's a concept called as body weight, which people should know. So the classic concept that an obese person, a fatty person is unhealthy is a wrong concept. The fat outside is not important. The fat inside your tummy is important. That is called visceral fat. Visceral fat can be very, very high even in a very thin individual. There is a lot of data that we see a lot of thin people dying with uncontrolled diabetes and a lot of so-called fat people not having diabetes. So this is a reality because so-called fat people have a lot of fat on the outside of the body, which is not damaging to the body except for cosmetic appearance. And this fat which is inside the body is more damaging. So you can have a normal BMI, normal weighted person, but he could suffer from bad diabetes. Whereas a person who need not be so thin but has a lot of muscle mass need not have a very high diabetes. Of course, I'm not encouraging people to become fatty, lazy, and crossing the weight limit. That is not the message that I'm trying to give. But please understand that it is body weight is not the only criteria. BMI is not the only criteria to determine type 2 diabetes. It is a fat inside, and that fat cannot be removed till you exercise. So what you eat is important, but what you do with that food, how do you burn that food is much more important. And that is the reason India is becoming a diabetes capital. That is the reason the younger generation today is having more diabetes than the elderly population, because today's young generation is 24/7 on a mobile or on a laptop.
Well, I'm glad you said that fitness is important and that activity is so critical. Being active is really the crux, and not just for the younger generation, but also for the older generation, and especially post-COVID.
And I'm sorry to stop you over there. Do you know that the best form to become active is to walk and to swim? The best exercise in the world today is not a 40,000 or 50,000 gold membership in a gym. If you can just walk 10,000 to 20,000 steps per day, if you can do some swimming per day for at least half an hour per day, believe me, it does the best caloric burning is achieved by those exercises rather. Of course, everything else is highly acceptable and welcome. But people who don't go to a gym or who can't afford a gym or who can't do all those exotic, luxurious burning of Hollywood and Bollywood style kind of exercises can go for simple walks 2 to 3 times a day. Works wonders. We have seen real good results, and diabetes can get reversed and has come down significantly by such simple measures. And what better proof do you want? Go back 2 generations and look at your own grandparents.
So when you say that, go back to your to your grandparents' generation, and also when you say diabetes can be reversed. I mean, these are 2 critical questions that I had. Is it the inheritance only, or it's the obesity, or is it just the food? It's a complex thing that who can actually get diabetes. But are there like 1, 2, 3, 4 sort of people who are susceptible to diabetes?
I got your question. It's very difficult to predict the weather. Is it going to rain tomorrow or not? It's not dependent on 1 or 2 things. It's depending on multiple variables. So it's very difficult to tell a patient that your diabetes will reverse because food is there, your lifestyle is there, genetic is there. So it's a complex interplay of many things. So what you said is very right. I'll give you 1, 2, 3, 4. So food is important. Let me give a small snapshot on food. We talk of something called as glycemic index. How much sugar, how much glucose 1 unit can give. So let's say I have rice. 1 gram of rice, let's say, how much glucose can it give? 1 gram of banana, how much glucose can it give? 1 gram is too small, let's say 100 grams. Or 100 grams of chapati, how much glucose it can give? 100 grams of pineapple juice, how much can it give? 100 grams of gur, how much can it give? The more glucose it can generate after digestion, that is a high glycemic index. So cut down foods which are high glycemic index, go for foods which are low glycemic index. Your glucose load of the pancreas will come down. Now, there's a different concept here. So if you're going to take a high glycemic index food and make sure that the digestion goes over 4 hours instead of 15 minutes, it becomes a low glycemic index. That is called glycemic load or modified glycemic index. So for example, potatoes are high glycemic index, right? Chapatis are high glycemic index. Rice is high glycemic. The moment you put protein or fat on the food, the digestion becomes delayed. Very important is fiber. You put a lot of fiber, digestion gets delayed. So when you're eating dal rice, when you're eating dal chapati, when you're eating masala dosa, let's take to dosa. When you're eating idli, these are staple diets in North India, South India, North. And then the digestion of this food is so delayed because of the protein moiety that a high glycemic index, which is present in rice and chapati, becomes a very low glycemic index. Similarly, when you're taking lassi, for example, or you're taking sugarcane juice, for example, of course, they're high sugar content. Now, are they bad or is Pepsi better? So if you take a 0-calorie Pepsi, I'm sorry, let's not, I apologize for taking, when you take a carbonated drink, which is low calorie, and you take a natural drink, which is not low calorie, which is not 0 calorie. And when you take an artificial fruit juice, a packaged fruit juice, and when you take an actual fruit juice made out of oranges and pulped it out. So what is the difference when you take an orange juice from a pulp? There is a lot of fiber in it because a lot of pulp, soluble fiber goes in. But when you take an artificial fruit juice, there is zero fiber, though it may be very artificially low in calorie and mixed with artificial sweeteners. So that is the difference. So when you take food which is natural and you take it with a lot of other additive foods, like a lot of salads, a lot of protein substances like meat, lean meat, or a lot of like putting up like different kinds of pulses or chanas and sprouts and all that, and you can add a little amount of ghee and a little amount of oil which is required for the making of the food. That's a very big topic, so I won't go into details of that. That food becomes less sugary as far as the pancreas is concerned because it gets burnt over a period of time. And then when you exercise frequently and completely, regularly, then the burning is very gradual. So 2 hours will actually, what happens is you burn a lot of calories, your sugars go down, your body asks for a lot of sugar, you crave for a lot of food, and again your insulin levels go high, and again you cause a lot of damage because insulin is a hormone which is a steroid hormone. It is an anabolic hormone. On the other hand, when you exercise slowly throughout the day, dhira dhira, thoda, then what happens is you're burning sugars over a period of time, and the load of the pancreas is gradually reduced, and you're giving healthy food, and the load on the pancreas is gradually increased. So simple things is natural food, complex carbohydrates, not simple carbohydrates, not refined foods, regular exercise, frequent exercise, multiple times exercise, a very healthy mind to keep your stress levels down, because stress plays a very major role in increasing diabetes, a good amount of sleep so your body can replenish itself very nicely, avoiding all kind of junk and artificial substances as much as possible. And sabse badi baat, if you want to eat sweets, if you want to eat some junk food once in a while, once in a week, or with a major meal, it is permitted. I never tell my patient not to eat rasgullas and gulab jamun. I insist that they want to eat one rasgulla, one gulab jamun. Have it after you take a half a plate full of salads, full of rice and chapati, so that that glycemic index gets molded and modified. But having two gulab jamuns at 4 p.m. with a cup of tea and no other fiber is a bad way to go for diabetes. So, you can have all the fun you want in your life. You can enjoy your food and live with diabetes in a very controlled manner. And this way, if you can actually work very regularly in a fantastic lifestyle modified format, we have so-called reverse diabetes. I have shut down the medicines of a couple of my patients. They're leading a very wonderful life with very minimum medicines. So, there's another myth that diabetes is totally reversible is a wrong concept. It doesn't happen that everybody's diabetes will get reversed totally and completely because your pancreas is damaged, but it can come under wonderful control for a very long time. You can be on very minimum medicine and the complication rate actually comes down. So A, natural food, B, lot of exercise, C, regular and small amounts of baby steps, but throughout the day exercise. D, avoid artificial foods as much as possible. Avoid artificial sweeteners which are not recommended by medical science. And D, very important, medical nutritional supplements. You need to add certain nutraceuticals, certain healthy additives to your food, which makes your food better. You can add fiber to your food. You can reduce the carbohydrate content of your food. You can give satiety with certain good nutraceutical products, which I'm going to ask you, Dr. Rajashree, since you are a leader in that. And stress-free life, yoga helps, meditation helps, control your anger, control your blood pressure, control your toxicity as much as you have. And sabse badi baat, please trust authentic articles and authentic sources of knowledge on Google and WhatsApp. Don't go blind for any other knowledge or source which is not recommended or approved by authorities. Simple 4-5 things that you need to follow, nothing major you have to do, and be very patient. Don't think that you were diagnosed with diabetes today. Within 3 months, I need to get rid of my diabetes. Such instant coffee reactions don't work. You take 5 years to reverse your diabetes. You take 6 years to reduce your diabetes, if not reverse. What are you losing? Nothing. But then that will go for a very long time. You want to cut down your diabetes in 2 months, you'll get it back in a big way for the next 20 years.
Absolutely. So like you pointed out those 4-5 pointers. I mean, the American Diabetes Association talks about when it talks about not just reversal but control of diabetes. It mentions that you have to include fruits and vegetables in our diet. Like you said, eat lean protein. while you're eating proteins, make sure it is lean. So, even while you're eating those pulses, it is very important to identify the ones which have more carb and more protein. So there is a difference there as well, because a lot of patients say that, I eat pulses, but, do you know which pulses? I eat a lot of non-vegetarian protein, but then, it has to be lean. And then, like the ADA, the American Diabetes Association, says, choose foods with less added sugar. And Dr. Modi, you did mention that, the sugar additives also we have to be very careful about. And of course, you have to avoid trans fats. The bad fat has to be kept out. And as much as we can keep the uh, the processed foods and the ultra processed foods out, that's, really very, very important. So, I think I'm probably going to take a cue from that and, share a few inputs, because quite a few things you have actually rightly pointed out in terms of nutrition. So,
Actually, Dr. Rajashree, I've tried to steer up to a very important aspect of diabetes, which is nutrition. And I have a celebrity sitting right in front of me. I would request
oh, no.
this celebrity to talk about it. This is just an introductory talk. We just wanted people to get stimulated to understand what is diabetes. But then, just depending only on your food and not taking proper nutritional supplements does not really hanker well for the disease. So, can I request you to give us a little insight about, with your vast experience on nutraceutical industry, and how it is helping up and how it has helped shape? Because some of the products that I've used from TruWealth have actually helped me cut down my insulin dosages and medications of my patients because of good nutritional supplements. So, dear friends, can I request Dr. Rajashree to please guide us in what this concept is all about? And you know who she is. She's a lady with 20 years of global experience in nutrition, nutritional formulas, who has conducted brilliant amount of corporate talk sessions, patient education programs. She's a big name in Facebook. You've seen a lot of her presentations. She has worked with different specialties of medicine like gastroenterology, gynecology, therapeutic nutrition. She's handled a lot of pediatric diabetic patients. She's a founder and CEO of TruWealth Integrated Health Centers, as well as RSG Energy and Nutrition and Healthcare Private Limited. And everything is genetic. She gets her genes from her father, who is a big name in the medical industry. We remember him with a lot of fondness, and he was a pioneer in nutraceutical industry. And she's carried the genes very well and is helping the medical fraternity in a big way with her excellent products. She believes that nutrition as a therapy can be a modern day's most effective and safe truth in many ailments, especially lifestyle ailments like diabetes. And with a vast experience of hobnobbing with a lot of big names in the field of diabetes in various national and international programs, we are fortunate that she can shed a small light on it. So, Dr. Rajashree, can I ask you a small question about what nutritional supplement do you think is relevant? And a second major question, why do you think it is relevant over medications?
So,
Small answer, because I'm asking you
thank you for the
to
long
very
introduction.
question.
The only last two parts, I mean, the gene part of it is something which is good enough an introduction. And secondly, of course, that, we are doing a lot of work together in helping people control diabetes and control diabetes complications, which is, which comes with a lot of syndromes together. That is what we are helping people out of. I think that introduction would be sufficient. And on that note, I will, of course, answer a question, giving a little bit of initial, introduction as to what, how, and why, nutraceuticals, again, supplements is something people have started thinking that supplements are only protein. No, protein supplements are not only protein. Supplements or nutraceuticals are actually nutrition in the form of medicine for people who are having lifestyle diseases. And what we're seeing that, the newer emerging lifestyles, and I like to do a few slides because this is what we, Dr. Modi, you were talking about, that, we all have gotten to all different types of gadgets. We sitting with mobile phones, tabs, and our, television and everything together. So that's what is happening. Having sedentary lifestyle because of course, work from home, but otherwise also, and eating junk food is something which we all fancy. So that's becoming another big hurdle. And then women, of course, women health and depression, along with the hormones, the way they act, is what is happening. So, mobile to immobile, with all those mobiles in our hand, we are becoming immobile. And, also we are having nuclear families, because of which, when we eat. What we eat is becoming a big concern. All these different food delivery systems that are in place today, it becomes very easy for us to order something in, and we don't know what's really going into the food that is being cooked. So that really is causing a worry. Occupational hazards are causing a worry. I feel also this is not so much a worry, but this has also become a fad. So like you said that going to a gym and wearing sport shoes is not the only thing. We doing a regular exercise is important. Having all these gadgets is excellent. They help us monitor, but getting relying completely on that and completely relying on the calorie counting only, and then just placing our knife and fork on it is not maybe the best idea for people having diabetes and having complications. What is happening despite of all this? India is still the diabetes capital of the world, and the number is only growing. So, what really could be lacking in all this? We are all told that you have to keep this balance with radical sleep, balanced diet, stay physically active, drink enough water. Are we all doing that? I mean, when we see all these kind of pictures, we get more stressed. I don't know how many of us can balance it out. The food that we eat today has saturated trans fatty acids, of course, refined sugars and carbohydrates. We don't even know where it is going. We eat a biscuit very easily, and it has all of this. Then fertilizers, pesticides that are being used is affecting the food that we eat today. Processed foods, artificial sweeteners, then there are antibiotics, hormones that are fed to the livestock. That is the non-vegetarian food that we eat. Also, the plants that we eat are so they are altered so much that we don't know what food we are eating if it's as nutritious. Then we all hear this that balanced food. That's why balance is absolutely important. So yes, we need to have 1/4 plate of whole grain, 1/4 plate of protein, and the remaining half of the plate should be vegetables and fruits. But how many of us are doing this every day? How many of us eat fruit once or twice a day? It's rare. Having proper hydration. Also, when we are talking about the balance, it is very important that cooking with the right ingredients, coming from the right source, this is what is important. And along with that, eating with focus and happiness is again very, very, I think, very important in case of people having diabetes and these kind of lifestyle diseases. So my question really is, but is balanced nutrition the only remedy? Does one diet plan work for everyone? Absolutely no. And why no? Because we have to understand what we are. We are the genotype, that is the gene that we got from our ancestors, the environment that we are in terms of the occupation that we do, in the place where we live, the traffic around us, people around us, all that affects us a lot. COVID affected us a lot. All these environments affect. Not much can be done by us in terms of these genes and environment. We can't change it much. So then what can really be altered is the nutrition and the activity and the fitness, which Dr. Modi was talking about as well. So nutrition is something which can really help us. And then if one size cannot fit all, because you have to understand that your metabolism is governed by your genes, your environment, your behaviors, your mood, hormones, enzymes. So if I eat a piece of vada pav and someone else is eating a piece of vada pav, there is a lot of difference there. Someone gets affected more and someone gets affected less. Your hypothalamus, I keep talking about this, which is a part of your brain, guards your body weight. So no matter how much you diligently eat and diet and exercise, not everyone is getting the same results. We are all hitting this metabolic syndrome, which comes. Diabetes is really the pivot. Everything happens around it majorly. And while that is being addressed, what is most important, I think, is comprehensive assessment with doctors like Dr. Modi, and also, a comprehensive assessment done with nutrition being also at the base of the assessment. So assess what type of foods you're eating, what are your habits, cuisines. That is what we do together, Dr. Modi and I. And, we really try to understand, going to the core, where the issue really started with the diabetes for the patient, and then help them set their goals. So setting goals is not always trying to lose weight, but setting goals is much more than that. If the person needs to work on his lipids or the fats that they are eating, or the carbohydrates that they are eating, or is it the activity? Everything put together has to be integrated, and a plan needs to be put together, not just a plan, um, but also uh, uh, but also making sure that his fitness regimen is well balanced with it, and that they are doing it regularly. So these are very important aspects. I feel low energy, keeping, normally this is what is advised for diabetics, is that you have to cut down your calories because you have to lose weight. So but the low energy makes your fatigue grow further. As it is, just as Dr. Modi explained, it is all about energy, really. The glucose, if we are not able to get the energy out of the glucose that we're eating, out of the food that we're eating. So as it is, there's low energy, there's fatigue when you have diabetes, and then you're going to cut down your calories further. If you land up cutting down on your proteins and essential nutrients, then the energy is further low. And the high fiber and the strict diet that we are managing, normally that's what the biggest catastrophe. This is where we can land up just not complying with the diets, and there's a failure. The success really is in the balance of nutrition, eating with mindfulness, keeping the energy, fitness, and the hormonal balance. This is very, very important. Keeping the health of the pancreas and the critical organs in your body, like liver, etc., is very, very important when it comes to resistance and sensitivity of insulin, and better management of the diabetes. So a personalized integrative medical and nutrition guidance is what I feel is most important. And Dr. Modi, I'm sure you will agree with this, because this is what we practice day in, day out. But when it comes to our nutrition fitness plan, or the nutrition that we normally put together focuses on the reversal, help you as much as you can reverse your disease. Make sure we are focusing on your energy and your mood, because this is very important, the enzyme and the hormone balance. And I'm going to quickly explain why enzymes and hormone balance is important, lowering your inflammation and keeping a fitness regimen. So of course you have to focus on calculating the macros as in the proteins that you're eating, the fat and the carbohydrate consumption. Yes, we make a critical balance for, depending on different patients. We make sure we give them how much protein to eat and how much carbohydrate they should cut down. A lot of tables are available online, but having a personalized plan is most important. Understand, we all talk about eating more proteins, but what are these proteins important for? Of course, they're important for muscle building, but in diabetes, why are they important? Because they are also a good source of energy without it hiking your sugar levels. So it is important to get energy also from proteins, and proteins are very important for hormones. So at the end of the day, insulin secretion, health of your organs, hormones are, for production of hormones, proteins are very critical. For production of enzymes which help break down your food, it is important. If the food breakdown doesn't happen properly, so even before, after the breakdown of sugars is different story, but before that, if the food is not broken down properly, it can elevate your inflammation in your body, and it can elevate the resistance to insulin in your body, and that way it can get very difficult to control diabetes. So enzymes have to be in the right form. So proteins are really important for that. And antibodies, we all have been talking about, staying away from infection. So proteins are not just important for muscle building and just for weight loss, but they're critically important for hormones, enzymes, and antibodies in our body. So how do you increase the proteins? You have to get, and I will emphasize in my next sessions, and maybe go over proteins specifically and separately and in depth. But understand that getting proteins from non-vegetarian sources like egg, chicken, and getting it from dairy and from plant, having a balance of that is also very important, because the type of amino acids that you're going to get from these sources is very important. Now, what happens is, most times, this is what Dr. Modi was referring to for supplements. If we are not able to get the proteins from all different sources, or if you're not able to digest the proteins that we're eating, that is the time we should not shy away from getting protein supplements. Now, when you choose the protein supplements, choose them in a way that they are not going to tax your kidneys, your liver. So it's very important that they don't become toxic again for your body. So it is very important to take advice from your nutritionist or nutrition expert, or from your doctor. Without that, do not just get resort to any supplementation just because it's cheap. Most times this is what happens, that you think another protein formula is cheaper, but that can actually be more disastrous to your body. Along with the proteins, it's important to take vitamins and minerals, and taking it together, it has a synergistic effect in your body for uptake of nutrients, and also keeping your body in good shape, your muscles, your bones in good shape. So you are able to stay active, more importantly. And there are, of course, a lot of vitamins which help in the reversal of diabetes as well. Most another important thing, which is won't go more deeper because Dr. Modi explained about lower GI, that is the glycemic index. But there are different foods which have a low glycemic index, and I've put a chart out here which you all can actually very easily read out. But you can see apples, the fruits, apples, bananas, etc. Bananas are higher, of course, on the carbohydrate content, but apples, oranges, the citrus fruits are something which we can rely on. Eating more complex carbohydrates, but with having bran with it, can actually be less processed. Grains can actually be better. They have lower glycemic indexes. So understand that you have to focus, even when it goes to carbs, you have to take those lower glycemic index carbs. This helps in controlling your diabetes great. It is also important to have fiber, because this will give you the feeling of satiety. Not just the feeling of satiety, but some type of fibers are also good for, they act as a prebiotic. So they help good bacteria to grow in your body. They are also known as, simple language. They can actually take care of balance the sugars that you're eating. So that is why fiber is very important to be consumed along with carbohydrates, along with the foods that you're eating. It needs to be eaten also with proteins, because for better digestion of proteins also, it's advisable to eat carbohydrates so your gut health stays well. We have different vegetables and fruits which are high on carbohydrates, and I've put them out here today. But at the end of the day, you have to optimize the fiber. But after eating all this, whatever you're eating, if it doesn't get digested well, then it's of no use. If you eat good amount of protein, but it's not getting digested well, then again you're going to stay low on energy, and that can actually give rise to bad gut health. And if your gut health is suffering, there can be more inflammation in your body. It can give rise to the resistance in your body. So more importantly today, resistance in diabetes is the critical thing, and here is where eating intelligently and eating supplements in the right place. So understand what is the most important critical organ in diabetes. It is the pancreas, because it secretes insulin. It also secretes the digestive enzymes, and if both of these roles of pancreas are not taken care of well, if you get diabetes, it starts to pump more insulin, and if it's suffering on the digestive end, it will exert itself to secrete more digestive enzymes. Now, in process, the health of pancreas suffers, and if the health of pancreas is suffering, then it's going to cause you more issues with your diabetes control. And in this process, and various international associations are putting forth the data that both, it's your gut health is very important. Enzyme rich foods need to be eaten, and if it is not possible, especially in diabetics, this is the area where you should be taking supplements. And we are seeing great results with supplementation. People are improving the digestion, and also are improving the control on their diabetes. We are seeing people, the sugars are coming so much under control that we are able to lower their diabetes medication as well. So that's where it is important to keep your gut health. If your gut health is not important, what happens if if there isn't enough enzyme supply, if food is not digested well, then in the small intestine there can be bacterial overage. That is, can be more bad bacteria, and this can then affect your mood. So what you eat, and if it's not digested well, you see food impacts the mood, and then mood in turn also affects what you eat. So if this tandem breaks, what we have seen, that there are two hormones which I will also explain later in depth, is renin and leptin. These two hormones are very much responsible when to eat, when to start eating, and when to stop eating. And if this balance doesn't stay, if your mood is not good, then your body is not able to identify when to stop. And increase in the weight can actually be very, very detrimental for your diabetes. So it's very critical to keep your weight under control, trying to lose calories, lose weight. And even 3-4 kgs of weight loss can actually be very, very good for diabetes. But don't make weight loss a stress factor in your life yet. So do those intelligent things. Keep yourself hydrated. Right now we are probably experiencing the hottest summer in probably past 1 century. And this the hydration is important. If your cells are not well hydrated, in that case also your resistance can actually increase, and your control can worsen. And we will throw more light on hydration in the sessions coming up. But I wanted to touch upon this factor that hydration is important. Maintaining an electrolyte balance is very important for diabetics, because it is very critical for your kidney performance and kidney health. So make sure that you are staying hydrated. Make sure you can have supplementation here with your electrolytes, so that the electrolyte balance stays in your body. Potassium and sodium is very, very critical in diabetic patients and in kidney patients as well. And make sure you're getting good antioxidants and fruits. Different types of citrus fruit, berries, pears can actually be a very good source of antioxidants. There are different foods. Like Dr. Modi said, yes, fat has to be kept under control. It is very, very critical. But good fat consumption can actually help further reduce the complications of diabetes. So eating good fat is quite important in diabetes, but keeping fat under control. And he explained this very, very clearly, that you can't exercise out the bad calories that you've eaten, but you still need to exercise. The bad calories can only be taken care by good nutrition. So you have to keep eating good nutrients consistently to be able to take away the bad effects of the bad foods that you eat. And it is 70-30 according to me, but it's not either or. 70% nutrition, yes. 30% of workout, yes. But doesn't mean that you should not be working out. You have to stay active. It is very important to stay active and do a full body exercise. It's very, very critical. It's not important that you just go and keep running in the gym or just keep doing weights. It is very important to have a balance. Maybe yoga is a good idea, but only yoga may not suffice. You have to walk, you have to burn calories. So it has to be a balance. So don't go after any of these fads continuously when it comes to nutrition, when it comes to fitness. Don't go to these paper diets, paper programs, and then there are suddenly newer inventions coming up saying, no, this is the type of fitness regimen you should follow. No, don't make it a fad. It has to be an attitude. Day in, day out, you have to practice good nutrition and good fitness, and that can actually help. And when you're in a bad situation, it is important to take these supplements really. And also, you need to make sure, you can't deny him. He's Einstein, of course. We all can't deny him. So everything is about energy. Balancing out that energy intake and the energy output is very important in diabetes control. So that's where I would again leave you back with saying that a personalized integrative advice from a physician diabetologist, especially like Dr. Alok Modi, and a nutrition expert is very, very critical when it comes to managing your diabetes. And this is what we do at the TRUWELLTH Integrative Health Center, and also with Dr. Modi at Kaivalya Hospital, and also at his diabetes care center. And what we do is integrate the medical advice with nutrition, and make sure that the patients get a meal plan which they can continue with, and we help them make sure that they are able to follow the entire plan altogether. So I'll end my few inputs here, and Dr. Modi, I think this was a very integrated session between us, the both of us, and we really covered a lot of points together today out here. Is there anything else that you would like to add to this? And because we have a few questions
No,
in terms.
I just add one line that you covered it so beautifully. You've done a PhD course in 5 minutes. You covered it exhaustively. I think people who are listening should be grateful because a vast field was covered in a very simple and a very beautiful manner by you. It speaks of your experience, which I really appreciate. Just one or two lines. Today is the word American Diabetic Association has come out with a separate arm. I mean, imagining a big industry like American Diabetic Association, a big pioneering recommended body is coming out with an arm called as precision medicine. So today, like you said, a diet chart or a prescription is not given for the patient to fit in. The prescription and the diet chart has to fit in the lifestyle of the patient. So, a person who's having breakfast in London, lunch in Paris, and dinner in India cannot be given a diet chart which is meant for somebody else who's sitting in the office. Why go for such a high profile personality? A truck driver does not get to eat for 12 hours. And they are not very socioeconomically affording. Even there are patients and they are also very happy. So their diet chart and their medications have to be tailored to suit their lifestyle. So today, good doctors and good nutritional advisors sit down with the patient, talk it over with them. Don't give them a printout. Work out on their lifestyle and change the scenario, the therapeutic approach to the patient based on what suits them, what they like. It's easy to say कि सुबह को 100 ग्राम पोहे खाओ, दोपहर को 2 कटोरी दाल खाओ, 1 चपाती कम खाओ. उसको नहीं चपाती अच्छी लगती, उसको नहीं दाल अच्छी लगती, तब क्या करोगे? So, you have to keep changing it as per the thing, and that is where the integrative approach or personal approach counts. Second point is, people who are listening should please know that high sugars are bad, like I said, but high sugars may not be so bad. They're worse to have low sugars. Hypoglycemia is even more dangerous. If you have high sugars like more than 250 milligrams for more than 5 years, you might damage your heart in your eyes after 5 years. But if you have sugars below 70, you can die within less than 30 seconds. So hypoglycemia is more important. A lot of people have a lot of hypoglycemia. That is something we should keep in mind, and they are asymptomatic. So just one or two pointers. I'll stop over here. I think it's important that we listen to the audience, and the program is for you, not for us. So we would be really nice if we can cover their questions.
So relevant to your thing, what you said right now about hypoglycemia, there's a question as to, how often should we be checking the blood sugar? Because I think this is very critical from both hyper and hypoglycemia standpoint.
The answer is very simple. I give it on a very humorous note. How often should I pamper my wife? More the better, right? दिन में हर घंटे करूंगा तो और भी अच्छा है. So coming to that, the more you check blood sugar, the better. You get a much better input about your sugar profile. And it's not important how frequently you check. How do you check? Are you checking it with meals, before meals, after meals, or are you doing a random sugar? That is more important. So see, many people come to us who are doing the fasting and post-lunch once in a month or once in 2 months. That is something I don't really feel comfortable because it doesn't tell you anything. And if you're doing fasting and post-lunch, which is a standard way of checking, what about post-dinner? What about 3 o'clock morning sugar when your dinner is at 10 o'clock in the night and subah ko, when the sugars will fall, what will you do? So what we recommend is what is called as SMBG, self-monitoring of blood glucose with a glucometer. And American Diabetic Association has come out with very good guideline. There is a 7-point guideline, which means you should check before breakfast, after breakfast, before lunch, after lunch, which is 2 hours I'm talking of, after breakfast, after lunch and all. Everything is after 2 hours, before dinner, after dinner, and if possible at 3 o'clock in the morning. If you can do this every day, very good, and correlated with your meal, and that values are not important. People come to us with a book full of some 40 figures. See, my sugars are this over so many days. It has to be put on an Excel sheet. A graph has to be plotted. We need to see the flow of blood sugar. So the more frequently you can do. Now, of course, it's difficult for anybody to check 7 times a day, every day. So sometimes we tell our patients, 3 times in a week, do it before sugars. Probably 2 times in a week you do after sugars, after meal sugars. Maybe once you do in a week before and once you do after a week, after meals in a week. So जितना आप कर सकते हो करो. It's not that कि नहीं करोगे तो नुकसान हो जाएगा और करोगे तो जितना करोगे उतना फायदा होगा. There's another modality which I need to tell people, which is called CGM, continuous glucose monitoring. I do a lot of CGM. In fact, my papers are published in American Diabetic Association on that. There's a small device which it's like a 5 rupee coin we put up on your body. It's a painless device. There is no operation. There is no anesthesia. It just sticks over there. There's no needle over there. It's a silicone fiber. And it measures your blood sugar every 15 minutes for 14 days automatically. Not the blood sugar, the tissue sugar, which is more relevant than blood sugar. And that gives you some around every 15 minutes of one reading every 4 readings in an hour into 24 into 14. Those many readings are converted by the inbuilt software into a beautiful 8-page report where you see the entire flow of blood sugars, correlation with meals, the angle at which the sugar is dropping, the angle at which it is rising. Much more information than actual values of blood sugar. So all that goes in deciding the to answer the question in a short way. If you can go for the newer techniques, very good. If you can go for the old techniques, the more you can do as per your comfort level, the better.
So I just want to also put some pointers here that I've been getting some messages also from Mr. Mani Subramaniam from Chennai. I'm getting the messages from Rita Patil ma'am. She's also a nutritionist. All of them are appreciating the education awareness program that we are doing today out here. So I guess, feather in our cap to begin with. Of course, today, we've tried to cover a lot overviewly, but we will be taking most of the topics in detail and still keep it simple so that people can understand more about the diseases. And you are, of course, I want to have an entire talk on how do we diagnose diabetes, because that's again a very people have several questions on that front.
There are 2 questions for you, Dr. Rajashree. Do you think mangoes are safe? I know you covered it. If you can just answer that.
Technically, mangoes, anything which is below 55 glycemic index is considered to be low glycemic index. Mango has a glycemic index of roughly around 50, between 50 to 55, depending on what is the.
So they are safe.
Variety. So they are safe, but they have a lot of carbohydrate and sugar content. But they also have a lot of fiber content in it, and it does contain a lot of vitamins, minerals as well. So that way mango is not completely a no for me at least, but we should be controlling the intake of it, of course. The kind of mango season that we have in India, one would dread just doing that as we did it as kids. But yes, keep eating with a balance will help. But
yeah.
It does
so
have
on a positive note, let's tell our patients.
It has a lot of it has about 65% of our daily intake of vitamin C. So it's actually quite good of fruits. It has folate.
On a positive note, I tell my patients, please don't deprive yourself of mangoes. ऐसा मत करो कि you don't have mangoes, but you start having a burger and a French fry. No, not that way.
Correct.
Better to eat a mango. What about watermelons? They're coming in a big way now. There's a big line on watermelon shops, and I love that fruit myself. Do you say, can we give or we can't give?
Unfortunately, we have to stay away from watermelons. Though, earlier the thought process was that watermelons are, they have so much of water in it. So is it the safest thing? But I think one of the fruits which there is lot of data coming up to stay away from,
But then, I like to be a different doctor. I tell them, thoda sa kha sakte ho to taste ke liye, just have a pleasure.
Correct. And you can balance it out by eating it with some vegetable or fiber or something like that, and that way you don't have to so much worry about the glycemic index. But you can do a lot of other good things in the day so that things stay under control. So I think
so like you showed, Rajashree, there are a lot of foods with low GI. Maybe we can upload this a little later. Foods like which have low GI, like apples are there, for example, oranges are there. For example, boiled potatoes are there, sweet potatoes are there, peanuts are there, something like beans are there. These are some substances are there which are highly recommended, which are good. Just in short, I'm talking like that. Maybe can we give them a small carry-home message before we conclude the program?
That has to come from you. We would of course want to take home messages coming from you. Like you in the beginning itself, you gave us a lot of them, but we would want you to conclude with them because that's what is very important.
So one wrap-up message I can say, this is an unholy marriage. Once you're married, you don't look for a divorce. This is a forced marriage. So if you've got diabetes, you can't get out of diabetes. So the biggest message I tell people is, please don't think your life has ended. Please don't think your life is destroyed. Please be very happy. Learn to live with diabetes. Be simple, be in moderate, be healthy, be happy, and eat relevantly. eat properly. Don't go overboard with over religious diets, and don't go overboard with junk food. Be moderate, take proper advice, and another important, take proper authoritative advice. Don't take advice from anywhere. Do you invest your money by listening to anybody? No. You go to a qualified person before you invest money. Do you go to the courts by any on your own? You go take advice of a qualified lawyer and advocate. So take advice of qualified nutritionists, qualified doctors. Get guided in your diabetes in a proper manner. And it is possible today to live with diabetes for 25 years without getting admitted in the hospital. And my own patients can vouch for that. I have a few patients like that. It is possible today to have diabetes which is practically reversed. Mark my words, practically reversed, with very less or zero diabetes. And a lot we see today is not because of medicines, it's because of lifestyle. Have a very healthy lifestyle, have a very nutritional support, and nutritionists today play a very important role in management of diabetes. You do that, you'll lead a very happy and healthy life with diabetes, and try to spread the message to others so that they don't become diabetics. I think I will conclude with this much, and always be positive, be very positive, remain positive. You'll cut down your sugars just by keeping a smile on your face. Trust me. If you yourself are sweet, why do you need sweets? You know, I tell people, eat food made of plants, don't eat food made in plants. They say obesity runs in the family. That's not true. Obesity does not run in the family. The truth is, nobody runs in the family. So, very nice thing, you know, keep smiling, eat your own, let people get sweetness out of your smile, and let's not eat unnecessary sweetness.
Perfect. So I think a very positive note to live well with diabetes is what and live sweet. You know, you stay sweet and you run are the three take homes that I am taking from your talk today. And it was a pleasure doing this with you. And we are of course going to run this as a series, and it's a very important topic for everyone with a growing number of diabetics in the country. And we will keep helping people. Control their diabetes and live well with diabetes is what I will close this
Absolutely. At the
program
end,
with.
I'd like to thank the audience for giving us this time on Sunday evening. I give a lot of credit for that. See, I'm smiling, you know, because of that. And we have another celebrity smiling for us. So all of you, please keep smiling. We want to see you smiling, and stay smiling when you visit us next time. And once again, thanks to a celebrity nutritionist over here who has given you tons of information in a very simple and concise format. So thanks to everybody, and have a great day, a great weekend, and have smiling years for years to come.
Thank you, Dr. Alok Modi, for being with us today. And of course, thanks to the audience for being with us. And I'm going to end the session with a short video by the Energia team, who has been supporting us at the back end. And I'll just play a small prelude of their products because these are some of them which can help diabetes. And we'll end the show with that. Thank you so much for being with us.